Well, good afternoon, everybody. I'm Liam Donaldson, the chair of the Integrated Care Board for the North East and North Cumbria. And we're sitting this afternoon as an Integrated Care Board for our annual general meeting. And we've spent the first part of the day in our routine public meeting. But I'm conscious that people who've logged on online to attend the annual general meeting may not have been to our earlier meeting, so we will not be referring back to specific discussions earlier because it won't be clear how many people have heard them. We've published an annual report and also a very, I think, accessible summary of the annual report. And I'm just going to start by making a few reflections. Then I'm going to pass over to our Chief Executive, Sam Allen, and then to our Chief Finance Officer, David Chandler, to talk about some of the financial aspects, because that is a traditionally very important part of any organisation's annual report. My reflections are set out in the foreword, and I've summarised them in some slides, just to give people something to refer to afterwards. But I'm not going to go through everything in a lot of detail. But I did very deliberately start the foreword by expressing gratitude to all the staff who serve the 3 million people in our integrated care system in all sorts of diverse ways and from all sorts of professional bases and from all sorts of organisational settings. And we continue to get a very, very high demand for all of our services. It's partly that we're still suffering from the aftermath of COVID. COVID is still, the virus is still with us itself in new variants, and in the large number of people who have suffered in the various waves, particularly the first two from long COVID, which is a distressing disease that is still the subject of a lot of research and developments in clinical practice. We also have rising demand from the increase in the number of long-term conditions and the number of frail elderly people, and those demands just continue to grow. We used to talk about winter being the real pressure season, but we've been through during the course of this year, we've been through a summer, an autumn, a winter, and a spring, which have all had exceptional levels of demand for health and care services. And as I say, the numbers are increasing. Looking at statistics for diabetes, we've got 200,000 people in the region with type 2 diabetes, and that number increased by 8% in only one financial year. So we're facing a lot of demand, and that's why I think great credit goes to the staff and the organisations that employ them for managing to keep their head not above water, but also to deliver a range and diversity of very high quality services. So the points that I highlighted in my foreword to the annual report were really to talk about some of the key themes that I think will be prominent in our work this coming year. The first one is to give a major boost to the objective first supposedly set out by Hippocrates, first do no harm, but of course famously repeated by Florence Nightingale, but still very relevant today. If you look worldwide and in this country, a lot of patients suffer avoidable harm, sometimes of a minor nature, but sometimes very serious. And that's something that we ought to be doing more about. And I know that the NHS generally is majoring on this, but we intend to make it a special feature of our work here in the North East and North Cumbria. And also, we have potentially a big transformational measure in public health that could come in this year. There's currently a public consultation for introducing an additional amount of fluoride into the water. It's been a feature, natural fluoride's been a feature of some parts of the country for many decades, but it's been shown from the evidence by topping it up to a healthy level, you can prevent a lot of decay that causes such distress to children and adults, but also to increase the level of oral health. The consultation's just coming to an end, and we're hoping that as many of people as possible will write in and support it. So that's really, I think, part of one of the themes that will be a growing one for this year. In the midst of all of the pressures of establishing the Integrated Care Board under new legislation in 2022, we have concentrated on the pressures in the system, trying to get the waiting times down and trying to deal with some of the backlogs of work that accumulated after the COVID pandemic had its main impact. But the other thing that we're very keen to do is to give much more prominence to preventing ill health. And we know our region has very high levels of premature death and long-term conditions that often produce many years of unhealthy life during a person's life. So it just doesn't shorten the years that people live, but it increases the number of years which are spent in ill health, disability, and poor quality of life as a result. There are major risk factors that we well know. Prominent amongst them is tobacco, smoking, excessive alcohol intake, unhealthy diet, lack of physical activity, and we intend to major on those things and try and get a program of work established which is in its early form, but is very important to the population of this region, where there are these high levels of deprivation that are linked very closely to the poor health record of the region. And then finally, we have been also working with our primary care services, but also our hospital services, to try and create different alignments of service which will benefit patients. And one of the partnerships which I was pleased to go down and launch earlier in the year was a partnership between North Tees and Hartlepool and South Tees NHS Foundation Trusts. It's an important milestone in collaboration, and it does two things. One, it brings together a more integrated pattern of services for serving the residents of the Tees Valley, but I think it also safeguards the future, because there's no doubt in my mind that as technology changes and work moves out of hospitals, that having critical mass of specialist services is vital to an area. And if you have small pockets of services, then I think it's almost certain that over time services will be concentrated in regional hubs. And down in the south, in Leeds and Manchester, we have very big hubs. But I think with this development in Tees and what's going to be happening in the northern part of the region, we're safeguarding the services for our population to ensure that we have the right specialists in the right numbers grouped together so that they provide, as I say, that critical mass, which means that standards of care remain high and the best researchers and clinical teachers are also attracted to a centre of excellence. So centres of excellence is something we're aiming for, and our foundation trusts are very enthusiastic about this idea of collaboration. So our ambition for the year is to improve care and create more time to focus on preventing ill health and reducing health inequalities. The purpose of the meeting today is to present the annual report for 2023-24, and I'm now going to pass over to our Chief Executive, Sam Allen.
Thank you, Sir Liam, and good afternoon, everybody, and those of you that are joining us online, a particular warm welcome to you. Just like Sir Liam, I'd just like to start by echoing my thanks to all who work across health and care in the North East, North Cumbria. I'd also like to express my thanks to all of our unpaid carers in our communities, to our volunteers, and also to the hard work, commitment and approach to partnership from our community and voluntary sector organisations. This is a region where health and well-being is a real partnership endeavour, and without all of their commitment and support, we wouldn't be able to do the work we do. And a particular mention also to our local authority partners who are also represented here around our board meeting. As Salim said, it's been a really busy year, and it's been an incredibly busy year in many ways, not just in terms of the ongoing level of need across our population, but also we've seen changes more recently in terms of government, and certainly as we chart the future, we'll see potential changes in direction of policy. All of those informed over the past year by key messages from our public, and our public have told us they want quicker access to care, they want their health outcomes improved, and they also want to ensure that our public sector resources are used most efficiently. As Salim has touched on, here in the North East, North Cumbria, life expectancy at birth is lower than the rest of the country. And what that equates to, particularly for the 20% of our population that live in the most deprived areas, is just over 8 years less if you're a woman and 10.5 years less nearly if you're a man. And those are health inequalities which have been widely reported over a long period of time, and working with all of our partners, we're absolutely committed to do all we can to see some change there. So it's been a really busy year for us. Our first year was one of transition from the 8 clinical commissioning groups into the Integrated Care Board. And our latter year, the most recent year, one of our most significant challenges, which I'm pleased we have been able to deliver, but also has had an impact at times on our capacity, has been delivering a 30% cut in our running cost allocation, which for the North East North Cumbria equates to about £17.5 million of savings achieved. And I do want to thank all of my colleagues who work in the Integrated Care Board for both their engagement in that process, for those nearly 50 colleagues who exited the organisation during that process, and indeed all the colleagues who have remained with us, who are now turning their hand to either new roles and also a new way of working, as we moved from having 13 teams located in our communities to 6 local delivery teams and a new operating model. And again, I want to thank our partners for their patience as we delivered those changes over that year. It's also been a year that's been characterised, I think, particularly for our NHS delivery partners, of one of sustained pressure as a result of industrial action. And again, I want to commend our system for the way in which they've supported one another through mutual aid and worked together during that period. And I do say this with hope and optimism that at our AGM next year, we are still not in the position of having to talk about the type of pressures that industrial action can bring to bear on services. I think our system whilst there have been at times real concern for the impact on patients, I think particularly where we, for example, asked the public to stay away from services, to look at all possible alternatives, I do think we have been able to handle that period with the least possible impact on our patients, and that's really down to the commitment and support of our clinicians on the front line. So it's easy in an AGM to sort of put fine words around actually the pressures on industrial action, but it is the values, the commitment of our staff working in health and care on the front line that have continued to deliver for us during that period. So, as I've said, we've delivered our running cost reduction this year, and in doing so, we've also had the opportunity as an organisation who employs several hundred staff and working with a commissioning support unit to have a deeper level of engagement and conversation with our staff. And as a new organisation that came together from those 8 previous organisations, we've been working hard and are committed to shaping a culture of openness, of transparency, a place where our staff feel and take a sense of pride in their work, feel valued, but also we've got a culture where people feel safe and able to speak up. And whilst we had mixed results in our staff survey this year, the first time we undertook that staff survey, inevitably at a significant time of change, I was pleased that when compared to other organisations, it appeared that we're on the right path in terms of having a culture where staff feel safe and supported to speak up. And my thanks to our Freedom to Speak Up Guardian and David for working hard to establish that culture. It's one we're going to have to continue to pay very close attention to over the course of the year ahead. But as Liam said, we've got high ambitions for the population, and just in March this year we published a refresh of what's called our Joint Forward Plan, and this is a plan that describes how the NHS is setting out in the North East North Cumbria to improve the health and well-being of our population. And within that plan, we've set some really key outcome measures. And my thanks to our Director of Public Health for their support in setting those. But they cover areas such as smoking reduction, such as suicide prevention. They also cover areas such as giving children and young people the best start in life and school readiness. And I'm pleased that in this year of transition, we've been able to look at those outcome measures and identify ways in which we can measure and report upon those, which we're starting to do this year. And delighted, for example, when it comes to, for example, smoking. We've reduced smoking in pregnant women by 2.3% over the last year, and there have been some other successes as well. Adults who smoke has reduced from 14.8% down to 13%. Now, again, that isn't one approach that's tackled that. That really is a whole system approach, working with our partners in health and care and placing our resources in the ways in which are going to have the maximum interventions. And I do think our smoking reduction programme is a large result of the smoking cessation workers that have been embedded and supported, along with the joint commitment from both health and local authorities to continue to invest in that area. I'm also pleased that we are developing our new quality strategy. We're co-producing that just today, and it's the culmination of several months of work across our health and care system. We have an ambitious plan for people and culture, and we've also established a housing, health and care programme which has garnered significant national interest and demonstrates again the role that an integrated care system can take when looking at people's health and the links to housing. We know, for example, the impact on areas such as respiratory disease if people have poor quality housing, and also the impact on their mental health. So working with partners services, our health, housing, care programme really takes a focus around supporting people to live well and stay independently in their own home, and is drawing on the best available evidence, particularly around the use of digital technology. So we've set out some very key ambitious plans, plans that have been co-produced, and we're working in partnership across our health and care system. And you can see there our plan is centred around our 4 key strategic aims, each with their own programmes of work, and I've touched on these previously. Our People and Culture Plan has 6 key pillars to the strategy, so particularly looking at workforce supply, and through the workforce supply linking in with our academic institutions across the region. This is a place where we want people to have long, varied careers, to have the opportunity to grow and develop their career here, to train and come into employment. I was really pleased that alongside David Purdue, our Chief Nurse, this strategic piece of work was led by one of the Chief Executives in our council, Pam Smith, and further sets out our commitment to looking at our workforce both as a health and care workforce. And within the strategy, you'll see that the well-being and health of our workforce is absolutely at the heart of that. Without a workforce that's healthy, that's maintained to stay in work, to be productive in work, we simply do not have a health and care service. We could have the best available buildings, the best technology, but it is the health and well-being of our workforce that's crucial. Also ensuring that we've got an inclusive and diverse workforce, which has been another key topic for our board meeting today. And we have the best available leadership across our system. So our People and Culture Plan is ambitious. It, as I said, puts well-being at the heart of it. But I think also alongside recruiting, retaining our staff, making sure we've got the academic work programmes, it places a particular lens on the culture. And for us over the past year as an integrated care board, we've had many examples where culture has featured as a challenge in our system, whether it's been the review of the North East Ambulance Service or Newcastle upon Tyne Hospitals Trust, and therefore as an integrated care board, placing safety and also culture, the way we do things, at the heart of our approach of our workforce as being key. So this is another ambitious plan that we've developed and is setting us up well for the year ahead in terms of delivery of that plan. I mentioned housing, health and care, and we are particularly proud of this programme as a shared endeavour, as I've already said, with our ADAS and local authority partners. And over this past year, we've again co-produced a strategy. We've also been able to work with partners to find access to new capital arrangements that can support us with developments, particularly for people with complex needs. And just on the point on complex needs, we've had a renewed focus over this past year around how we can support people with a learning disability to move out of long stay accommodation, sometimes many, many miles away from their community, to bring them back into their communities, into suitable supported accommodation with wraparound care here in the North East, North Cumbria. We're not where we want to be on that. When you look at the numbers of people from the North East, North Cumbria that still remain in those placements, but I'm really proud of the progress that we've made and also the innovative partnerships working with the community and voluntary sector that are and that will enable us this year to make more rapid progress in this area. And of course, it's one thing having the workforce to provide the care packages around individuals, but we do need the environment. So, and some of these need to be purpose-built, and they will take time for us to build, working with partners here in the North East and North Cumbria. Improved access to primary care services has been a huge area of focus for the public. We know through the Ipsos Mori polling that whilst public satisfaction has dipped in the NHS, there still is significant commitment to the NHS. And one of the messages that's come out loud and clear from the public over the past year is how can we improve access to primary care services, including general practice, optometry, dental and community pharmacy services. We've undertaken a range of initiatives over the past year, and our Pharmacy First approach is now being scaled across England. So we've really led the way here, and 39,000 consultations for issues such as urinary tract infection have now been catered for by our community pharmacy colleagues, whereas prior to that, this would have meant individuals accessing GP appointments. We've also, over the past year, really recognised, as we've had the responsibility for dental services delegated from NHS England to the Integrated Care Board, recognise actually we have a huge piece of work to do on dental services. And indeed, just recently with our newly elected members of Parliament having spent several weeks on constituents' doorstep, this is probably the key topic that the public have raised. We know that this requires some quite significant reform of the National Dental Contract. However, there are things that we've been doing over this past year through our Dental Recovery Programme in terms of increasing access, and particularly around urgent dental access. We've invested an additional £3 million in this to do everything we can to retain, stabilise and protect NHS dentistry. What I would say, though, is that this has really been like trying to put the plug in the sink, really, as we have seen NHS dentists hand back contracts almost as fast as we increase capacity. Although I am pleased over this past year we have been able to increase our urgent dental capacity, and we've seen investments go initially into Darlington and Carlisle, and we now do have a model for urgent dental services that will be implementing across the region over the year ahead. We've also, through the National Recovery Programme, supported practices to tackle what's been known nationally as the 8 a.m. rush. What I would say, though, is that we have a lot more work to do there, and we've got a lot more work to do to work with and support general practice with this particular issue. But you can see through innovative thinking and ways around UTI treatment, work to tackle what we call the interface, the relationship between general practice and our hospital-based trusts, but also working with the community and voluntary sector. There's a lot more we can do, particularly to improve access to primary care services. What we can't do quickly is knit enough GPs or certain professions. This will take time, and this is why it's been so important to get our people and culture plan in place, particularly to look at workforce planning. I'm really delighted that this past year we've really set ourselves apart, I think, from many of our similar organisations across England when it comes to women's health. We set a very high ambition for women's health, and we've, over the past year, launched our women's health programme with 7 priority areas. And why are we doing this? We're doing this because when you look at our population health data, women do not fare well here in the North East. We know that there were disparities in the way COVID impacted women, and it hit women far greater in the North East than it did in other areas. And jointly with the Office for Health Improvement and Disparities, not only have we produced the first data and needs assessment pack for women's health in England, we've now got a dedicated women's health programme that has included 3 women's health hubs. We're also the first integrated care board in England to employ somebody leading on menopause treatment and working across our system. So in terms of setting ourselves apart from other ICBs, we've got significant ambition for women's health. And at this point in time, we have a big conversation going on with the public, and we will take the results of that back in to drive and inform women's healthcare. The first hubs for women's health are in Sunderland, Gateshead and North Cumbria. They all look slightly different, and we'll be taking the learning from each of these into the programme to consider ways in which we can scale women's health hubs as an approach to women's health across our region. We had our second conference recently. As I said, we've published a needs assessment. It is available on our website, and we will take the outcomes of that into our women's health programme. So what are some of the specific things we've done over the past year? Well, really delighted that we've invested 2 million in alcohol care teams, and this is now in place across all of our NHS organisations. And I think when it comes to the NHS, we have a greater role to reduce alcohol harm. So Liam put a particular slide up looking at the data there. We know that we still have a high number of alcohol-related admissions to hospital. We have a lot of harm caused by alcohol. It impacts on areas such as increased domestic violence. So again, this is something we need to take a whole system approach. And from the ICB's perspective, investing in this was absolutely key, particularly in terms of addressing the outcomes we set in our plan. I'm really pleased that we've been able to open the doors on a brand new urgent treatment centre in James Cook. And in fact, when I first came to the North East just over 2 years ago now, one of the very first trust I visited was South Tees Hospitals Trust. And one of the first people in the ICB I talked to was Craig Blair, who's sat here today, who was absolutely instrumental, I have to say, in this development. And when I was at South Tees, which, as Liam said, is one of our tertiary centres of excellence, a large number of the population of Middlesbrough were attending the emergency department when quite simply they didn't need to. And why was that? Because the urgent treatment centre was located in Redcar. So it was really clear we had a compelling case for establishing an urgent treatment centre on the site of James Cook. It required significant capital, and through the underpinnings of a detailed business case, we secured the capital, the only available capital for the North East and Yorkshire. I hasten to add for James Cook, and the doors have now opened on a brand new urgent treatment centre, which is a fantastic development for perhaps one of our most deprived parts of the North East and North Cumbria, and that development we'll look forward to tracking the outcomes for it. Not only will it alleviate the pressure on the emergency department, enable them to focus on emergencies, but it's much better access for the people of Middlesbrough. We've also worked hard, and I do want to commend our provider collaborative, the partnership with our 11 Foundation Trusts, and we're joined today. We have our chair of our provider collaborative, Ken Bremner, around the table, who also leads on our digital diagnostics programme. And whilst we've got more work to do there, particularly using diagnostics for the early detection of things like cancer, we have been able to expand our diagnostic capacity quite significantly across the North East and North Cumbria. We've also worked with our ambulance trust over the past year, and we've improved our category 2 performance by 10 minutes year on year, which is a significant achievement following COVID. We've supported now over 9,000 people who are waiting for surgery through our Waiting Well scheme. And what that scheme does, and that's a shared endeavour working with public health, and Dr Neil O'Brien, our medical director, has led this, and it was an innovation that stemmed from COVID, is to target people on the waiting list. This could be people, for example, who are diabetic or pre-diabetic. It could be people also who live in some of our more deprived areas with specific support to help them prepare for surgery. And we're seeing some tremendous outcomes through that programme. We've also continued to invest in early mental health support through the voluntary community and social enterprise sectors. Winter, as Sir Liam said, is now an all-year endeavour, and even just these recent weeks, we've seen significant pressures on our emergency department services. I would add, though, I think through the additional investment of extra care navigators and emergency departments, focus work on falls prevention and investment in acute respiratory hubs across our region, we've been able to work through winter and use some of those investments to ensure that we can keep services running. We have recently been identified by NHS England as one of the 4 high-performing transforming systems on urgent and emergency care. And at the heart of this, again, is a real partnership endeavour. Our urgent and emergency care network is co-chaired by our medical director and one of the deputy chief executives in the NHS Foundation Trust. We work closely with our colleagues in social care who have been absolutely fantastic over this past year in terms of utilising discharge funding and supporting the wider system. This is something which really is now a 365-day-a-year endeavour, and in fact the network has already set out their priorities for the next few months, but to be recognised as one of the leading systems on urgent and emergency care is a real achievement and one to be celebrated. Now, what I want to say, though, is that all sounds fantastic, and there are some things that are just, we have to be proud of, and it's important we are and are celebrated. But we do it very much in the spirit of continuous improvement. There's always something that we can improve. And again, that has been a real focus and decision of the integrated care system over the last couple of years to establish ourselves as a learning and improvement system. So if I give you a real example of that, because people say, what does this really mean, being a learning and improvement system? Well, it means on urgent emergency care, people don't sit in a room and decide what are the best things we need to do. They use data and insight. They bring in people who are doing the work. They have an open approach to people with lived experience, members of the public, how they can get involved. And one of the ways they do this is through our learning and improvement community. We now actually have over 9,000 members of our learning and improvement community. And in the next couple of weeks, we will launch our Learning Academy through Boost with a particular focus on health inequalities. And through Boost, we've set up collaboratives, which is essentially communities of practice drawn from all parts of our system coming together to focus on issues, whether it's discharge and safe transfer of care, whether it's leadership, or whether it's women's health. So putting learning and improvement at the heart of what we do needs to be something that we're explicit about, and we've got the enabling infrastructure, and that's what Boost does across our health and care system. So in terms of the year ahead, we have to manage our resources wisely. Last year, we had a deficit plan as a system, which was £50 million. We have the same plan that we've agreed with NHS England this year, but it always gets slightly tougher. So don't... when I say 50 million, we've lost some additional funding through the funding formula, and also we've had to increase the number of recurrent efficiencies we need to make across the system. And indeed, you'll have heard me talk at the board before, for us as a region, about the quadruple whammy, which is essentially how the funding formula, inevitably, because of population size, favours areas where the population is ageing and where the population is growing. We have an ageing population, so that's one whammy, but we do not have a growing population. It is growing in certain parts of our region, but as a totality, it's fairly static. It's a fairly static population. And you'll have heard me talk about the health inequalities here, which means sadly people live longer years with lower quality of life, particularly women, because they live slightly longer, but also less years. So this is a really challenging situation to be in, and I think, as Sir Liam said, it's one of the reasons why we have to see greater collaboration, because if we don't, with a fairly static population, over future years we'll continue to see funding being moved out of the North East, North Cumbria into other areas. So we've got to collaborate to make our pounds go further. We've got to continue to be efficient, and we've also got to make sure that we maintain our quality standards as well. So we have set up a system financial recovery board. I co-chair that with one of the NHS Trust chief executives. We've got dedicated programmes of work which are all focused on how we maintain our quality, but also are as productive and as efficient as we possibly can across our system. And we'll continue to focus on this for the foreseeable future. Other areas of focus for us over the year ahead now will be our clinical conditions strategic plan and how we use our data to drive population health, and also focusing on those key conditions that are going to have the biggest impact. And Neil O'Brien, our medical director, gave a presentation on our 5 strategic clinical condition areas that we're focusing on, and those have been identified by looking at what the prevalence of conditions are across our system and the impact they have, and we'll be working across the system to develop specific plans and interventions to tackle those. So I just want to briefly just touch on performance and improvement now over the past year. So we've worked with providers, as I've said, to mitigate key risks and issues. Part of the overall challenge the NHS has faced since COVID has been growth in our workforce, but a reduction in productivity. We've actually had we have had growth in our workforce in the North East, North Cumbria, and we do have challenges, particularly around productivity. And of course, some of these are related also into the industrial action. We've got a workforce improvement programme set up where we're looking at how we can make sure that we're reducing the amount of money we spend on temporary staffing, whether that's through agencies or through NHS temporary staff banks, and also how we have the right type of staff doing the right type of things. So also looking at, with a particular focus around greater efficiencies, particularly for non-clinical staff. Really pleased with the progress that we've continued to make on our elective programme and waiting lists, and a huge credit to our NHS provider trusts on this, and we are on track to deliver against our elective recovery programme, and also performing the best in aspects of that anywhere in England. And we're improving against our cancer standards too. We do know that part of the challenge in our population is later diagnosis of cancer, which inevitably leads to worse outcomes for some. So we're focused on improving the earlier diagnosis for suspected cancer within the 28-day period. And at the moment, that happens for nearly 75% of our population compared to the national average of about 71%. So we want to stay ahead on that. We have really ambitious plans for that. Part of that involves things like targeted lung health checks, and I'm delighted we're absolutely at the sort of pinnacle in the country of rolling out targeted lung health checks. It's the right thing to do. We still know that our mortality rate, particularly around respiratory disease and cancer, is higher than it should be given the needs in our population, and that we're investing in and implementing targeted health lung checks right across our population. Performance against the 4-hour standard in the emergency department, when you look at the sort of aggregate level across our system, is at 76%. What that means when you look at it right across the integrated care system, it means we have some trusts performing at about 85%. And some lower than 76%. So I think whilst, again, we perform well on this across the system, one of our focuses has to be in tackling the unwarranted variation that we've got. I've mentioned already we've improved ambulance response times, and the North East Ambulance Service is rated as the best performer in category 1 and 3 calls at the moment, with significant improvement at category 2. And 61% of people receiving treatment will have done that within 18 weeks. You'll remember that before COVID, 18 weeks for referral to treatment was the standard target, and we're absolutely aiming to be back there. But again, testimony to our provider sector and working across the whole system, that in these areas we perform the best, not just in the region, but in England. But we mustn't be complacent, and it takes a huge amount of effort. Our GP practices have offered more appointments this year than in previous year. I think, is that something to be celebrated? I'm not sure. We had a good conversation on our board today about the way in which the public is using general practice and the expectations, but just over 1.7 million appointments in general practice just in the last month in our region. They are working incredibly hard, and I think going back to the point about health and well-being, we need to do more, I think, around the well-being of our colleagues who work in general practice, given the pressure on them. We've got our primary care access recovery plan in place. And just a final highlight for me, particularly around the sort of health inequalities, we are highlighted as the best in the country for controlling blood pressure in people at risk. Over 74% of people now who have high blood pressure have that controlled. Again, there's still 24% of opportunity for improvement there, so we're not complacent, but thanks to our colleagues in general practice and also our clinicians who innovate in the digital space that makes it easier to identify and target these individuals, we're doing well there. And I think that's something this system has performed well on consistently over a period of time now. So just finally, and I've mentioned some of these before, but I just want to kind of finish because I think as we look to the year ahead, we'll have to really keep our focus up, particularly around dental improvement. We are still in the process of trying to stabilise NHS dentistry. Yes, we've made some good inroads around urgent access, but stabilising NHS dentistry, supporting the dentistry workforce and enabling all members of the population across North East North Cumbria to be able to register with a dentist, to be able to have access to dentistry. We are some way away from that at the moment. So this year we'll continue to focus on stabilising dentistry, and I'm optimistic that that will come with reform of the national contract, which will be a big enabler for us with that approach. So, Chair, what I'd like to do now is hand over to David, who's going to do a review of the financial performance over the past year.
Thank you, Sam. So I'm going to give you a quick overview of the accounts and the financial performance of the ICB and the ICS over the last financial year. I've got three key messages for you. Just try and keep this as simple and as clear as possible. So key message number one, the ICB delivered all of its statutory financial duties. That's something that we as a board are directly accountable for. And then the wider ICS delivered the financial targets set by NHS England, and that's an area that we have lead responsibility for. When I say the ICS in financial terms, what that means is the ICB and the 11 foundation trusts. It has 23-24, it's got to be said that to be able to sit here and say those key messages to you is no small achievement. It was a very challenging financial year. We started off the year with an awful amount of financial risk, and we were dealing with issues such as increasing demand for services, industrial action pressures, and the impact of high inflation, both the previous year and in the current year. So I think it's important that we offer our commendations and our thank you to everybody in the ICS who's been responsible for helping us sit here and present that to you. Not every ICB or ICS is in a position to do that. In terms of the ICB, this slide just quickly shows you the three duties that we were responsible for. So number one, not spending more of our resources that were allocated to us. We had a small surplus, and that was used to offset an overspend on the provider side of the ICS. Our revenue, our running cost budgets, we didn't overspend against the target that were allocated by NHS England, and we did not exceed the capital allocation that was allocated to the ICB either. On the ICS side of things, we had a target, as Sam said at the start of the year, not to have a deficit any greater than £50 million. We were able in the year to reduce that to £35 million. And during the latter part of the year, we were allocated non-recurrent cash support, which was allocated to the provider sector, which enabled us to be able to have a plan, if you like, a revised target of break even, and we delivered a small underspend against that target, notwithstanding a small technical issue that happened at the end of the year in South Tees, which was agreed by NHS England. On capital, then a very challenging year in capital. Inflation pressures makes it very difficult to live within the resources that we're able to spend, as well as the impact of something called IFRS 16, which is a change in technical terms in terms of what is counted as capital and what isn't. But we again were able, with some support from NHS England around that technical side of things on IFRS 16, to deliver against our capital plan. This last slide is put up there just to sort of share with you the the ICB is responsible for 5% of the NHS England ICB budget. We are the largest ICB in the country. We're allocated just under £7.5 billion. That's an enormous amount of money that we're responsible for. The table on the right hand, the donut on the right hand side, which hopefully I think is clearer in packs, shows you that approximately 50% of resources is allocated into acute care, physical care, and the other 50% is sort of split between things like prescribing, primary care, mental health, packages of care and the like. The third key message is that you don't have to just take my word for it that the ICB achieved its financial targets, as did the ICS. For the ICB and for other organisations, we're subject to an internal audit. For the ICB, that was conducted by Mazars. They gave us a clean bill of health. They gave us effectively an unqualified audit opinion. In these terms, unqualified is actually a good thing. It's not often you can say that, but that basically means, as I say, a clean bill of health and no weaknesses, for example, found in any of our processes and controls. The last thing to sort of say in that area is that we were quite pleased to see from Mazars that they especially noted the quality of both the accounts and the working papers that ICB colleagues were able to present in front of the auditors, which no doubt helped the audit process go as smoothly as possible. And they were all of my key messages, Chair.
Thank you very much, Sam and David. I think we're now on to the item where we ask Claire if we've received any questions from members of the public.
We have no questions from the public, Chair.
Okay, thank you. In which case, I'll declare the annual general meeting closed and thank you everybody for attending.